Well, greetings, everyone. We are back, and we've got our third cluster regarding the series that we put forth regarding language services in conjunction with Martti by UpHealth, and the team has rejoined us. And we're very, very appreciative of that. I've got John Lawlor, who is the regional sales director for the Eastern U.S. He's going to be introducing his two teammates, and we'll then dive in some questions. So, John.
Thank you, Brian. Yeah, I appreciate it. So, again, John Lawlor, I'm regional sales director here at Martti by UpHealth. And I wanted to introduce, and I'm very proud to introduce, two of our industry experts, Danielle Meder and Tatiana Cestari. Danielle, by title, is our Director of Organizational Quality and Partner Support, and Tatiana is our Director of Language Service Advocacy. So I will hand it off to the experts and take a step back.
Well, we're very, very appreciative as the Center for Health Affairs and Champs Healthcare to have you guys as a corporate sponsor for the last couple of years, and really have learned a lot over the last two clusters regarding this series, and want to dig into it even more. This time we're going to be looking at the industry and your place within it, meaning the organizations that are going to be viewing this. So I'm going to be asking kind of an open-ended question here at the start. Tell us about the language industry, its global nature, interpreting modalities, as well as their myths.
Sure. So that's like if we were playing Jeopardy, that's like a $10,000 question, right? So
make it 25.
I'm going to.
There you go.
Right. So interpreting and language access have been around forever. It's just a matter of prioritization in environments to make sure you're actually providing the right resources. There's a reason we have laws on the books around healthcare interpreting in the United States. And really, remote interpreting has been around, like Martti's been around for 20 plus years. And so it's not new. But what we really saw with the onset of the pandemic is that getting really flexible and nimble in how we meet the demand for language access was mandatory on behalf of the providers like Martti, on behalf of the folks in the patient's clinics room, and as far as patients as well who have to get comfortable with perhaps not having an on-site interpreter. And the beautiful thing is that because things are remote, you really can leverage global resources, ideas, strategies to really meet the demand in ways that we weren't maybe meeting that demand previously. And so the current state of it is booming, and that's because we're actually really leveraging so much talent and innovation across the globe instead of maybe only leaning on the resources in our backyard. I mean, case in point, John doesn't live near me, nor Tati, nor I, and we were all working remote to a certain extent before the pandemic. But with the onset of the pandemic, and here we are 3 years later, we're in a really great place to just really make a lot of advancements in ways that weren't possible before.
That's great.
I'm going to add a little bit about the modalities. So right now we have in interpreting, we see on-site, or that means face-to-face. You're physically present in the same location. We also have remote, and remote could be via video, via audio only, but through a tablet or a computer, or via telephone. Like you actually hold a telephone and talk through an interpreter that way. And there are many, many, many myths around which modality I should be using or not. One of the ones that I hear often is the quality of the remote interpreters, or let's put it this way. The quality of on-site interpreting is greater than remote interpreting. And as Danielle said, most of us who were working on-site or face-to-face had to transition to remote interpreting during the pandemic. Let's think about that. The other part of that is it doesn't really matter whether you're remote or on-site. What matters is if that interpreter has been trained, is truly qualified, is fully fluent in the languages, knows the terminology, the phraseology, and all that in the specific specialization they're interpreting in. So it doesn't really matter. Yes, of course, there are certain circumstances where on-site is more suitable than remote, but there are many others where remote is actually better. When it comes to timely service, sometimes, and I've seen it both in rural areas and also metropolitan areas. Like there's in certain cities in the United States, it's very difficult to access those areas, big cities, and some doctors are not able to just take an hour because of traffic from hospital A to hospital B within the same system to care for a group of patients. So they rely on telehealth and remote interpreting that way. So there are many different ways and many different myths around that. Also, the quality, the word quality also means something objective, that comes from numbers and data. How are we evaluating the performance of a remote interpreter versus the performance of an on-site interpreter? Are we actually doing the same thing? Because quality assurance for remote interpreting has been around for many years now. Actually, Danielle's career involves many of these things. But are we able to also do quality control and quality assurance in on-site interpreting? Right now, those type of programs are not fully developed. So are we measuring the same things? Are we doing origins and pairs or oranges and origins? No. Right now, so we have to be careful with that. And of course, there are many more.
Yep.
What are the differences, and you just brought it up, so I'm going to play off of it, which is, what are the differences between interpreting and translation processes?
Sure.
I can start. Oh, yeah,
Yeah,
go ahead.
No, go ahead.
Okay, so
I know people are asking themselves right now,
okay,
going, aren't those the same?
No,
but they're not, are they?
Not. Okay,
Yeah,
so just the action of interpreting and translating is different. Interpreting is done on the spot. Most of the time, not all the time. Sometimes you have the ability to obtain information before you're interpreting that session, and that's very common in conference interpreting, that interpreters are able to know what the topic is going to be about. Maybe the presenter is going to provide their presentation to the interpreters. They can prepare for that because that type of interpretation is done simultaneously. So they need to have as much information as possible to deliver the service. So that's interpreting. Interpreting is rendering the message from oral to oral or verbal to verbal, however you want to see it.
Sign to sign.
Or sign to sign or verbal to sign versus written. So when you have a written document that needs to be now transferred to a different language, that's translation. And not only the actual, the acts of those are different, but also the processes are different. For example, in translation, since it's a written conversion of the language, you have multiple layers of like a quality assurance process in place. Let's say, for example, whether it's machine assisted or not, there's a first draft of a translation. Then an editor or a second translator comes in and helps edit that document so that it's more accurate, or it's more localized or tailored to the audience. Mm-hmm. And so there are several layers of quality control and quality assurance that can take place because you don't typically obtain a translation within seconds. Right. You can't. It's impossible. All right. Especially if it's a very specialized document. So you have safeguards in place so that the final product is the way it should be, the highest quality. With interpreting, there are also some quality assurance and quality control ways to make sure that the final product is as it should be, the highest quality. However, it's all on the spot, okay? So it's just like when you are in live TV, you know, if something goes wrong, you either try to fix it right in front of them or you have other ways to help with that. But it's typically, and Danielle can talk a little more about this, it's on the spot. So if I'm an interpreter, I only have milliseconds to make a decision of what word to use when I talk about A or B or something like that. So it's, as I'm processing that right now, like what are the words I'm going to use in English when I'm interpreting? I'm also doing that exercise in every millisecond. What word am I going to use in Spanish? Or when I hear Spanish, what word am I going to use in English? And there's some monitoring processes in place. You can have professionals monitoring remote interpreting sessions. You can have many different quality assurance structures in place, but the final product is delivered right away. You cannot take the time to edit it, to make it pretty, to make sure that you know every single person in that translation process can take a look at the product in interpreting.
Right.
Any other limitations associated with, you know, limited diffusion and research pertaining to this?
We have to remember that it's 250 languages, right? We've said that at the beginning. It's robust, and that's most commonly spoken languages in our country. But we can see migration, immigration, and refugee trends that are bringing stronger, smaller language minority populations to our country. And remember, the interpreters come from these communities. And so you're not only looking for someone who speaks this language, like Mandingo, for example, and then also speaks English at a professional proficient level, who also has the healthcare interpreter training and qualifications to then service it. So it's keeping in perspective the size of these communities, how many speakers of this language exist in the world and now are living here. And so it's a constantly evolving process. So as we think about healthcare providers who are in short supply for any number of reasons, and it can take a little bit extra time planning, communication, strategizing, the same thing applies for interpreting and other language access solutions. The smaller that language population, the fewer you're going to have of those interpreters. So again, putting things in place to anticipate those needs and having strategies available when, let's say, translation isn't immediately available or interpretation isn't immediately available, but how do you layer on those solutions to provide the care you need to provide?
Is there anything else regarding like the expectations, especially from the language service companies? You know, what should organizations, you know, be expecting directly from an organization like yours, especially around like you just said very, very eloquently, you're getting a mass of, or an infusion of individuals from different countries, such as the Ukraine. And so, you know, how can the healthcare providers out there and the administrators plan for that? You know,
it's all about the relationship you have with your provider, right? It's about participating in conversations that are looking at the trends that are going to help your providers and your team understand that interpreters are not, and I have a drawer back here, are not just in a drawer hanging out waiting to be put to work, right? That they are a part of the healthcare system and team. And just as you see ebbs and flows within your healthcare space and your providers and in your communities, interpreting language solutions are no different. And so if we're able to manage expectations together, talk proactively and anticipatory of what is happening in your local community and what is happening in the language access space as a whole, because a shortage of one kind of language is not likely unique to one vendor. It is a systematic piece across language access. It's not that one vendor has all of one language interpreters in this room and they're not sharing them, right? Because interpreters who come from these smaller population groups are incredibly committed to providing as much access to their community near and far as possible. And so again, it's managing expectations, remembering that interpreters are real people and it takes training and specialization, and that bilingualism does not an interpreter make, right? I speak Italian very casually. I take lessons every week. You don't want me to be your interpreter. That's the good enough box that you would check. So organizations, healthcare organizations should be demanding partnership, communication, and having subject matter experts on the bench who are here to help, because doctors are experts in their piece, vendors, language access companies are experts in theirs, and you just have to find a way to really leverage each other's expertise to meet the needs of your patient population.
Do you ever pick up, I was just going to ask, predicated off what Danielle just said, do you ever pick up individuals from the hospitals who then become part of your team, kind of in ancillary or secondary type of roles because of their language capabilities? Is there strategic partners like that, or partnership opportunities?
Yeah, so one of the solutions that we have here at UpHealth is we have a micro call center solution where your staff who maybe speak that language can also get the training necessary to be an interpreter and then help meet the interpreting needs of your community. So they can take on interpreting in a remote environment. So to Tati's point earlier, sometimes it's really hard to run clear across kingdom come to go meet that one patient. And so we can help with our solutions by creating a call center environment so that your interpreters can be leveraged on site and remotely across their health system. But again, that's partnership, right? We have partners who have really diverse patient populations and have interpreters available, but they can't be everywhere at the same time. So using one of our solutions in that kind of strategy session, we realized, let's just have your folks work remotely, but also on site where necessary, and support you meeting the needs of your community with your interpreters and ours.
Yeah, and I was gonna add when you were talking about limitations, but also this partnership, you really need to look at data. That that relationship has to be data driven.
Yep.
Decisions need to be made based on data, and I would say that for the longest time, and I come from a research background, very specific to basic sciences and very quantitative type of
pharmacology is what makes her a data person. She shies away from it, but
what I'm trying to say is I've seen a lot of data from the language service industry. However, many of it is very qualitative.
Yeah.
Some quantitative, but not enough. And then we have had to help set the right expectations because of these type of research, publications out there. So the more quantitative research we have out there, the better.
Excellent. Since we're going to talk about quantitative and qualitative, I love those two words because I'm all about KPIs. Yes. But to have KPIs, and also what I'm also hearing is that you two are both educators, and so let's get down to what we've been teasing everybody with for the last couple of rounds. Let's talk about this co-authors of a textbook regarding these types of services, which I think is phenomenal, and it's a huge dedication and passion piece for both of you. So let's hear about it.
Yeah, so we are among giants on who we wrote this textbook with. It's Catherine Allen, Dieter Rudge. I don't ever say his name correctly. And then Sarah Stockler-Rex, myself, Tati, and then there is Caroline. Yep. Yep. And so we are all working for what you would say that we are all competitors at our employers, but we all come with collectively.
Co-optation.
Yeah, co-op, exactly, right?
It
is 100% true. And so there's nothing out there, right? There was a book written a couple decades ago now, 20 years ago, and that was about over the phone interpreting. And we all assembled prior to the pandemic. About 6 months prior to the pandemic, we had, think about Power Rangers assemble, right? We all kind of came together. We were brought together by Marjorie Bancroft, who was a founder and ran cross-cultural communications. And so we all came together to start writing about remote interpreting and all of its facets. And nothing's ever been written before to this capacity. So it is a huge book, very comprehensive, 2 volumes, 600 pages plus each volume.
Wow.
I mean, you name it, we wrote
That's
about
hefty.
it. But
Yeah.
it is really the first time this has ever been out there. And because training and interpreter training is semi-standardized, but still in its infancy in a lot of ways compared to maybe some other professions, this really was our first attempt to document everything about remote interpreting and really give interpreters with no experience, some experience, lots of experience, the tools and resources to really bring their best performance to every remote call.
Does that become the new standard for the market?
It will be when the book comes out.
Yeah.
Yeah, right.
I was gonna say, even though the book was written in English,
Yeah.
and many of the authors live here in the United States, there's some that live outside of the United States. This book is an international textbook. It can be utilized by any entity, any person, any university, organization,
Language pair,
company, language. Yeah. So as long as the person understands English, they can apply to any other language. So that to us it's big. And also Danielle mentioned 2 volumes. So the first volume is about fundamentals on remote interpreting. So protocols, skills, ethics, your portfolio, laws, all that kind of stuff, professionalism, all that.
self-evaluation.
Self-evaluation. And then the second volume is about specializations in remote interpreting. So healthcare, business, conference interpreting, legal interpreting, you name it, educational interpreting. So we're very excited about it, as you can tell.
Oh, it's incredible. I love it. I love it. I've got one more question that I'm going to kind of do some free form with you regarding some questions at the end here. But what do you anticipate the near future of language access and compliance to it will actually look like? Especially since you're setting it with a new standard, regarding your textbook.
Yeah, we talked about it in the beginning. Language access to be as immediately thought of as washing your hands before you go into a patient's room. If I'm not mistaken, there had to be a whole campaign put out there by the American Health Association, perhaps, about washing your hands before surgery because there was contamination and things happening. And a whole campaign was done. And while we are a federally mandated service in the healthcare space, we are not federally funded, reimbursed, subsidized. And so that can also make it a challenge for healthcare systems to provide because we are a mandatory budgetary item that isn't always a friendly budget item, right?
Yeah.
And so future state is twofold. It's really making sure that when someone says, oh, I have someone who doesn't speak English, the first thing is get an interpreter. First thing, because they know the quality of their care is dependent on how much everyone's communicative autonomy is supported. You can be a phenomenal doctor, but if you're not talking to your patient, your phenomenal doctor skills are really limited. Second is that the funding or prioritization of funding based on performance, specifically around language access in the healthcare environment, becomes a priority at a state and federal level.
Yeah, and I would add to that technology has a huge role in all of this, not just for the delivery of the service, but also even if you only run a company that provides on-site interpreting services, you rely on technology to schedule these interpreters to make sure that they, the process, the operations of the company run smoothly. So technology, digital transformation, all of this is going to be together in the industry.
Yep.
That's great. So I want to hear about the use of your services, especially around behavioral health, because behavioral health, especially due to the pandemic, has increased exponentially. And so, I've learned from all 3 of you throughout the series that you should be at that forefront, kind of like you said, with the hand washing. And with that, how does that integrate directly with the behavioral health needs that are increasing throughout this whole world at this immediate time?
Yep. John, do you want to answer that one?
I'm gonna let John start that if you want.
Yeah, so it's a good question, and so I in the last year and a half, 2 years, being here at Martti by UpHealth, what I've found is that I'm having more and more conversations with behavioral health facilities than ever before. And there's a need for it, like with the pandemic and what happened with pandemic and behavioral health being brought to light as a result of the pandemic, truthfully, there's more and more needs for it across the country. And we're seeing just a huge influx of behavioral health facilities that are specifically requesting language access. And so what I've really pushed for is that behavioral health doesn't stop necessarily at the English language, right? Everyone in the world really needs to have access to a behavioral health therapist or professional in some capacity, and having access to the language that you speak really opens up that world for really everyone across the country and truthfully across the world. And so it's become a huge need, and from the sales perspective, and that's the side that I play in. We're seeing a number of different behavioral health facilities, hospitals, truly across the country, reaching out to us on a regular basis.
Yeah, I can
it's
see
great.
that. Like them waking up and saying to themselves, hey, look, I got to serve all these different communities of individuals that have different cultural backgrounds, upbringings, and language. And now I've also got to address their behavioral needs. How are we going to do this? And so the use of telehealth, telemedicine, God bless ATA, the American Telemedicine Association, for really promoting the services these last 3 years and keeping it going and building upon it. But I can see that the direct correlation into your organization and your services.
It's forced if there's silver linings to be found in a pandemic, right? Yeah. It has forced everyone's hand at exploring telemedicine strategies that are inclusive of diverse patient populations. I remember at the beginning of the pandemic, you would see telehealth platforms coming out talking about how they can now have their doctor visit on a remote platform for any number of things, and language access was an afterthought, right? Yeah. And integration was an afterthought for some of those platforms. And so, here at Martti, we're language access and behavioral health and at the cross section of that, so that when you are looking to provide behavioral health solutions and services, and maybe your local community is overwhelmed and doesn't have the resources available, we can leverage this huge network, this global and national network. And then if in fact you do have a patient who doesn't speak English, you can layer in the interpreting services. So it's not just non-English behavioral health support that UpHealth supports, it's any behavioral health, but we also have the distinct honor and privilege of understanding the cultural and linguistic needs that come for patients who don't speak English.
That's great. I always end these types of calls with what I call the magic wand. Okay. And that is, if you had a magic wand, what would you wish for regarding changes for the use of language services and access? And let's start with Tati. What would you wish for? You have a magic wand,
Don't
it's in
steal
your
mine.
hand. Go for it. What are you thinking?
I'm gonna go for this one. I know it's been very difficult sometimes to provide language services to many different people, and each state within the United States has been generating their own rules or regulations, and it's been very difficult for us interpreters, especially sign language interpreters, to be able to provide language access to people in various states. Because if I need to become licensed in each one of these states, imagine how much time, effort, and money needs to be put there in order for me to provide the services. So and I know I know what I'm saying is very difficult, but if I had that magic wand, I would not let that intervene or be a barrier for language, the provision of language services, because unfortunately it is right now for many of us interpreters, especially when you work remotely. If you work within your state, that's fine. Yeah, absolutely. You need to comply with those requirements, but then, yeah, also many of us remote interpreters want to comply with those requirements. But if I have to comply with the requirements of 50 different states, 50 plus, let me just put 50 plus areas, it's very difficult. Very difficult.
Right. Danielle, you got the magic wand. What's your dream?
My dream actually is that every med school program would have a special session, maybe not an entire semester, because I can understand that, but more than just one lecture on working with non-English speaking patients and deaf and hard of hearing patients. And they actually have to go through simulations of requesting an interpreter, partnering with an interpreter, and really walk away understanding what it takes. And it takes longer with a non-English speaking patient because of the interpreting process. I have been in this business a very long time and have been almost exclusively in healthcare, and I can't even count how many providers I have interpreted for. And it is the first time, and they're 10 years into their practice, that they've met a non-English speaking patient, which I don't always believe because I'm sure they've met them before, but they've used other not best practice language access solutions. So to really, really ingrain in them early on in their education that you're going to come across these patients and this is best practice, because then they'll go to their hospitals and their clinics and become ambassadors because this is how they were taught and this is now what they expect and out of their organization.
I think you all three have done that today. I want you to know that, Danielle. John, how about you? You've got the magic wand. What do you want to change? What do you think that needs to be changed around language access and language services?
So with the magic wand, my answer is short and sweet, very simple. I want to provide equitable access to healthcare for all across the country, no matter where you are, no matter the modality that you're accessing care. That is my mission. I know that's our mission as an organization, whether it's just telemedicine, in person, et cetera. Every patient in the country should have access to care, and they should be confident going into a healthcare facility, knowing that they can clearly communicate and feel comfortable with the communication in every facility. That is my magic wand.
Love it. Absolutely love it.
Ryan, what's your magic wand?
I'll tell you, I'm glad you asked. I personally think that we need to keep the push on telehealth, telemedicine services throughout the world, that there needs to be universal standards, that it needs to be not only cost effective and affordable, but for full scale reimbursement, and it doesn't, the interpretation services don't need to be an additional, a side piece or a connector type component. It needs to be all encompassed. And I think I really feel your pain throughout this series around that. But I also see it from the provider side, that if they don't have a team with the outreach and the reach of an organization like yours, they're really in a tough time, and they really need to make it a forefront issue versus something farther downstream and only taking the perspective, oh, this is just telehealth. It's not just telehealth. It is in all modalities. It is for your in-person as well as for your virtual visits. And so I see that and I hear it. And I think I've gained a tremendous greater appreciation. I think others will too, who are listening. Yeah. So with that, let me do this. Let me give you another quick round of applause and gratitude. This is just my way of doing that. But I am deeply, deeply touched by your participation, Tatiana, Danielle, and John today. Again, Martti by UpHealth is a team of innovators dedicated to providing and building solutions that address the healthcare disparities impacting patients across the nation using telehealth. Martti's language access solution puts certified and qualified medical interpreters within reach with one-touch simplicity in over 250 languages, 24/7. And so I want to say again, thank you. We're very, very appreciative. And for CHA and Champs, I'm going to wave goodbye and on to the next series. So thank you all for being our participants and speakers.
Thank you for having us.
Thank you. This was great. Thank you so much.
It was.